Happy Wednesday, everyone, and welcome to the All In for Kansas Kids biweekly webinar. It is August 11th. I'm Debbie Deere, and I'm joined today by Bria Cudney and Hannah McGahey. And we all work for the Kansas Children's Cabinet and Trust Fund and are happy to be here with you as part of the webinar planning team. Our agenda for today will be to share general updates with you on opportunities that we have available, and then information on how you can engage with the Early Childhood Recommendations Panel. And our program segment today, we will hear a presentation from the Kansas Department of Health and Environment on their care coordination initiatives. There's a free ABC home visiting training opportunity. The United Methodist Health Ministry Fund is announcing availability for up to 4 individuals to be trained in the attachment and biobehavioral catch-up, infant model that will be held virtually in October. And so ABC is an evidence-based 10-session home visiting program for families with infants between 6 and 24 months old who have experienced early adversity. And this program is designed to buffer the harmful effects of toxic stress and help restore normal early childhood development. ABC uses a strengths-based approach for coaching caregivers and broadly focuses on building healthy families through the development of secure attachment, nurturance, and positive regard. If you're interested, you can join an informational webinar, which the link to that is on here today. And this is with the University of Delaware. And then ABC staff will learn more about expectations for the training and certification process if you join the webinar. And if selected, individuals will work with the Health Fund staff in the University of Delaware to schedule and complete a 30-minute video conference interview. And so you can also find the link to apply for this opportunity listed here. An equity, inclusion, and diversity training opportunity with CEUs is available. It's that time of year when many educators and professionals will need to identify children's strengths and challenges to provide needed support to meet their developmental and learning needs. And so the data unfortunately shows that many children of color, children from low-income households, and children from linguistically diverse backgrounds are placed in programs that exclude them from equitable learning opportunities. But more importantly, it does not meet their needs. So in fact, children are programmatically misplaced because many assessment and screening tools have not fully centered on their cultural wealth and identified screening tools or the multiple intelligences children bring to the learning setting. So Dr. Ihioma Iruka from the University of North Carolina, Chapel Hill, will cover these topics to ensure all children are comprehensively assessed through a lens that affirms their assets. And so this training is scheduled to be on Thursday, August 26th from 1 to 2:30. You can register now at this link. And spots are limited for live and recorded options. And if you can earn 0.2 CEUs for $15 through the University of Oklahoma by participating. The Kansans Can Success Tour, which is sponsored by the Kansas Department of Education, kicked off on July 26th. And so Dr. Randy Watson, the Kansas Commissioner of Education, is making his way across Kansas to facilitate conversations for feedback on what your vision for K-12 education into the future looks like. And so this is a follow-up tour that was similar from 2015. You can visit Kansans Can Tour to get more information and download flyers. Your help is needed to help shape the future of Kansas education. So we want your input. Please help spread the word of this tour to your colleagues. There is a Grant Writing 101 webinar this week. Individuals make up the biggest slice of the fundraising pie, but foundations are second, accounting for about 15% of charitable giving nationally. So if you want a bite of that pie, you can join veteran fundraiser Judy Keller, who we just heard from at our last webinar, and she will be providing information on the grant writing basics, beginning with foundation research, followed by the keys to writing successful grant applications. So you can reserve your space, the link here for the Thursday, August 12th, which is tomorrow from 1 to 2. This is a Zoom webinar. And so you can also reach out to Danielle Brower at ku.edu if you have any questions. The HERO Relief Child Care Assistance Funds continue to be available for working Kansans who make 250% or less of the federal poverty level. And this includes waiving the family share deduction for essential workers, reducing deductions for all other workers, and expanding the eligibility period from 6 to 12 months. And so there is more information available at kansasherorelief.com. Friday Night Live events are live virtual trainings presented by nationally recognized speakers and organizations. And so the training, Fill Your Pitcher Before You Pour, which is promoting adult resilience, is taking place this Friday, August 13th from 6:30 to 8. You can register on Casito's Friday Night Live page at the link provided here. And you can also earn 1.5 KDHE clock hours if you attend this free event. There's also another Friday Night Live event scheduled for September 10th. And that one is called All Children Come with Families Attached, Strength-Based Strategies to Build Family Resilience. So we hope that you will take a look at these and earn some clock hours while you're at it. Moving forward, as part of our general updates during the webinars, we will routinely start sharing out information on the Early Childhood Recommendations Panel. The panel regularly meets on the third Friday of each month from 9 to 11:30 a.m. And you can watch these meetings live on YouTube found on the Children's Cabinet website. All meetings are also recorded for your convenience to watch at any time. And I think that we maybe have some current panel members joining in here with us today. So to start this off today, for anyone who isn't familiar with the panel, if we want to go on to the next slide, I want to give you an overview of what this is all about. So the panel was established by Governor Kelly with executive order in February 2020. And it serves as an advisory group to the Kansas Children's Cabinet and Trust Fund, which was designated as the Early Childhood Advisory Council. And so it plays a key role in implementing the All In for Kansas Kids strategic plan, which you hear about a lot if you listen in here with us very often. And it can respond to challenges, it can elevate recommendations from panel members, but also hearing about those needs from communities and stakeholders. And those decisions help achieve the strategic plan vision. And so the panel encourages individuals and organizations to share your thoughts and concerns in either written or verbal form. And so you can visit the Children's Cabinet website at this link, go to About, click on to the Early Childhood Recommendations panel. You can go to the role of the panel and the document roles, norms, and procedures to find information on the details of how the Kansans open forum comments can be made. And you're always welcome to submit those to me by the day before the meetings at 5:00 p.m. So we want to hear your voices. Again, this helps us make decisions that move the work of early childhood forward in Kansas that I know that almost all of you, if not all of you, are involved in. So to review the current and upcoming work of the panel, we just started year 2 of the panel on July 1. And we got to meet a lot our new and returning members. So we have 15 new members. We have 26 returning members for a total of 40 on our panel. We learned about the agencies and organizations that they belong to and what the areas are that they would like to see for the panel to focus on this year. A new meeting format was introduced that's going to start happening at this month's August meeting, and it includes upcoming focus work groups in the areas of childcare recruitment and retention, family partnerships, and quality and environments. And so if you are interested in viewing any of these meetings or interested in these particular work groups, we welcome you to join in and be able to watch live, or again, it'll be recorded so you can go to it whenever it's convenient. So our meeting is August 20th, and we will be hearing about the Supporting You Peer Support Program and Kansas Early Learning Standards, as well as the work groups that I just mentioned. So that concludes our general announcements for today, and we are now ready to begin our program. And we want to welcome the team from the Kansas Department of Health and Environment that will be presenting on the All In for Kansas Kids Care Coordination Initiatives. So welcome to all of you that are joining us.
Hi, thank you, Debbie, for that welcome. And hello to everyone. Debbie, are we able to share our slides?
Yes, I believe you are.
Okay.
Hannah is switching that over now.
Okay, let me.
Yeah, Heather, you should be good to just go ahead and share screen and it'll just shut off what we have. You're good.
Okay, which my screen just disappeared here. Where's my PowerPoint? I had it all pulled up, ready to go, and then there we go. So what happens when you come back from vacation and try to get on a monthly Zoom call and try to do something productive? Okay, can you guys see the slide deck? Okay, this is what happens when you try to get off and take a break and you forget how to use Zoom, apparently. So, well, hello, everyone. Thank you for the time to chat with you today and share some of the exciting activities we have here in the Bureau of Family Health as it relates to care coordination and specifically as it relates to the All In for Kansas Kids and Early Childhood initiatives. So we'll just jump right in, and I'm going to do a brief introduction. We'll let each of the speakers can certainly elaborate on their intros when they get to speaking. But we'll start. My name is Heather Smith, and I'm the System of Support Section Director here within the Bureau of Family Health. In addition to overseeing our statewide programming for newborn screening and birth defects, I also serve as the Bureau's contact for family and consumer partnership work, our Title V Special Healthcare Needs Director, and the Maternal Child Health Block Grant Coordinator. But probably more importantly than who I am, the two colleagues that are joining today, Casey Bigler and Kaylee Goss, are doing the bulk of the care coordination work. So this is really their work and their initiatives to share. So Casey oversees the Community Partnerships Unit within the Bureau, and her role overseeing core public health programming, such as the Kansas Special Healthcare Needs Program, Early Intervention in Part C, and our local maternal child health services. She's also our lead for the Bridges pilot program, which you'll hear about here in a minute. And then Kaylee is our system of care consultant within the system of support section. And her role, primary role at this point, is to lead our holistic care coordination primary care expansion efforts that she'll share about as well. Before we get started with all of this, we really wanted to take a moment and try to share with you a video that introduces our topic and some of the work that we have going on. So hopefully this will work well and you guys can hear this. Somebody holler at me if you cannot.
Holistic care coordination is really about looking at the whole person and family. What affects that child and family that is going to lead to positive outcomes for health?
It's a system that works on all levels to coordinate the care and meet the needs of children and their families through integrated systems.
Trying to make it easier to navigate, making it easier for families to get where they're going, to get the services that they need.
That we're not just looking at the client, we're looking at the whole family.
Holistic care coordination for us is not just looking at the medical aspect, it's looking at everything that the family needs. The housing, transportation, school, social needs, legal needs. Sometimes we do have those families that are very private, and what we do is that we just start building that trust relationship.
So sometimes it's connecting on that personal level and that emotional level that just takes care of the physical thing.
And it might not be just the child, but it might be the family. If you have a mom, for example, with postpartum depression, we need to take care of mom's postpartum depression before we can get all of the baby's needs met.
And the families enjoy it too, by the way, because they finally get a chance to be able to talk about these other issues.
The two biggest things that an individual or an organization or a provider might need to think about is really how are you going to engage the families in the population that you're serving, and how are you going to engage your partners and build up a network so that you can provide effective holistic care coordination.
So as you can tell from the video, holistic care coordination is really an approach to coordinating services, care, and other supports that a person might need. It's done in a holistic or whole person manner, which really recognizes that you can't silo or separate a person from their circumstances, or that their circumstances impact their health and well-being, educational and career outcomes, their ability to be included in the community and have community engagement, and their overall life experiences. So that's really, we're going to start the video over. That's really the premise and the vision that's been set forth for the Holistic Care Coordination Initiative. And this vision, as just to note, was actually set forth by our Special Health Services Family Advisory Council during a programmatic strategic planning process back in 2013. So families of children with special health care needs working with our program guided us, led us to begin thinking differently. Rather than thinking about how we have always provided services, they helped us realize that we really needed to stop. We needed to listen more. We needed to shift our focus to thinking more about how to meet their needs and not how to keep doing things the way that we've always been doing them. So while that work did start in 2013 with families telling us what they needed, it was quickly noted that this model would be really valuable for families across the state with or without special health care needs. And when the All In for Kansas Kids initiatives came around and we started working on addressing the needs that came out of the early childhood systems needs assessment, it was really recognized and realized very quickly that there was an opportunity for us to partner across our state systems and across our programming to find ways to do this more effectively and more robustly for families. So in alignment with strategy 2.1 within the All In for Kansas Kids plan, care coordination really is there to support local communities in meeting families in where their needs are in more comprehensive ways, which focuses a lot on the quality referral, coordinated care, and easier system navigation. So where we are today and the projects that have kind of unfolded under the early childhood systems work have been rooted in this original vision, which stemmed from the initial plan for adding and creating a care coordination model within the special health care needs program. Additionally, way back then, we identified that we thought there would be value in us expanding the model to other public health programming, such as early intervention, home visiting, other local public health service delivery areas, and to help assure families can access these services throughout primary care as well. That's where the work with the All In for Kansas Kids and the partnership with the other state agencies have really come into play. So the care coordination program started back in 2016 with a pilot program with special health care needs, and then full implementation in 2017. And then today we're going to share with you about the advancements and expansions of the other organization partnerships and the primary care expansions. So we will jump right into that. And I am going to actually pass it now to Casey to tell you all about the Bridges pilot.
Hello, everyone. I'm so excited to be here with you today and to share about the Bridges project and how it aligns with everything. As Heather said, I've been involved with the holistic care coordination since I started here 7.5 years ago at KDHE. So it's a very near and dear to my heart and very exciting to see it move forward. As you can see, I'm going to share about the Bridges, but it totally aligns with all of the All In for Kids Strategies 2.15, especially the objective 5.3 when we talk about the Bridges program. Heather, if you would advance. So currently, when we began the thought about Bridges, there was discussion between infant, toddler, special healthcare needs staff, and we realized that the current reality with what we were hearing from all of the providers in the field was that there was an identified gap in family support when children age out of the infant toddler program. And we were really thinking about how could we help fill that, because we know that transition from Part C to Part B is very different, and the focus goes from family focused to child focused, and how could we help with that? So we knew that this could be a very difficult and stressful time for parents and children, so we wanted to really assist them. We wanted to help them understand, especially at this early age for children, you know, parents don't know, they don't have a handbook to tell them how to do everything. And so we wanted to really be able to be there to support them in navigating all the various systems of care without that familiar support that they have always received from the infant toddler providers. And then we wanted to really make sure, regardless of the setting that children transition to, that the change occurred in a smooth way, because we know it can be very difficult. So whether they transition from Part C to Part B, or whether they transition from Part C into community services, we wanted to really make sure that that was successful for the families. Next slide, please. Okay, so Bridges, it's really here to help. That's why we call it Bridges, was because it was bridging that gap. And again, I told you it was a collaborative project between the Tiny K and Special Healthcare Needs. Both, you know, those of us that really started talking about this were parents of children with special needs. And so we really kind of got the importance of the infant toddler program and come from the background of infant, toddler, and special healthcare needs. The mission, in collaboration with the Tiny K and the Special Healthcare Needs program, will provide holistic care coordination to transitioning children and their families to assist them in navigating the complex systems of care for a smooth and stress-free transition experience. And when we say navigating all of the complex systems, we mean everything. That, as the video said earlier, that could be housing, that could be food insecurity, that could be mental health issues, that could be financial or legal issues. Depends on what that family's barriers are that are also a barrier for the child getting the services that they need. Please advance. Thank you. So really, Bridges is a pretty simple program. It's really designed for any child and family who are exiting the infant, toddler, Tiny K service. There is no other criteria other than that. There's no financial criteria, no other eligibility other than they at one time received Tiny K services. It's highly qualified and skilled special healthcare needs staff members who have been providing holistic care coordination for several years now. They will then transition into also providing it for the Bridges clientele, which just means that they would have a wider variety of disabilities than what they currently do, which is not a problem for them. But they're going to provide it in that same holistic fashion. And families can remain on this program with a yearly renewal of application up until the child's 8th birthday. So we're not only helping with that C to B transition, but we're also helping with that transition into kindergarten and kindergarten into grade school and beyond. So we're pretty excited to be able to help families get through the difficult years. Staff and families collaborate. This is a partnership. This is a relationship building program. This is not the care coordinators telling families what they must do. It is working with the families to identify needs, resources, and to develop an action plan together to really help ease that transition and make sure that we're helping families in the way that they best need it. It also is in various communities across Kansas. It's a pilot. We're hoping to show the pilot the advantages to this and really hoping to spread and scale this across Kansas long term. So when you look at families and you add the Bridges Care Coordination, you get the community because they're linking families to all the community resources that they can. Please advance. So kind of wanted to just go back of where we've been over the last year. When we received the funding from the All In for Kansas Kids, we were so excited because this really gave us this opportunity to advance this idea that we had. So over the last year, we've completed all the tools for the Bridges Care Coordinators to use. So things like the action plan, the assessment tool, letters to families, just different things that we could put together that could help families and advance that, as well as training manuals for the Bridges Care Coordinators. We modified the special healthcare needs data system, so Bridges is its own program within that system, so we can get the data for all of the families and really track what is happening with the families. We developed protocols and procedures and put those into a written process book. We developed and held trainings for all of the Bridges Care Coordinators that really equivalated to over 20 hours of training, as well as they are going to be getting every month. They will have a 1 hour touch point that we'll talk about in a little bit, which is additional training and supports. We established infant, toddler, tiny K partnerships and shared their responsibilities with them, developed contracts to as kind of a thank you for their partnership, and really had a lot of excitement among them. We developed and implemented the contracts and have those already in place. And we developed a brochure, Bridges brochure, that then can also be shared with families. Would you advance, Heather? Thank you. So for families, what are the steps to becoming a Bridges family? Well, it's pretty easy. Infant toddler programs will, of course, when the child is, at that 3 to 4 months out from turning 3, we'll let families know about the Bridges program. At that time, or if families hear about it separately, they just get an application from their infant toddler provider. They complete that application. If they need help, the infant toddler providers have graciously agreed to assist them. It's a very brief application. It's basic demographic information and then a release of information so we can communicate with the infant toddler, with the schools, with others that maybe the family needs us to help them communicate with. And then the infant toddler provider will send that application on to the Bridges Care Coordinator in their area, and they'll schedule an introductory meeting between the families, the Bridges Care Coordinator, and themselves so that everybody can get to know each other and just start that relationship building. Again, remember, there's no medical or financial criteria. I really want to stress that. Bridges is absolutely free to families, and they can opt out of the program at any time that they want. They only need to be receiving Tiny K services in order to participate. So partnering with the local Tiny K, as I said, they will get the application from the families, and then they will send it to the Bridges Care Coordinator. The Bridges Care Coordinator then is responsible for entering the application into the data system, emailing a confirmation to the Tiny K partners, and then the Tiny K providers will schedule the introduction meeting with the families and themselves. And we like to have this meeting. The goal originally was to be in person pre-COVID. Now it's whatever's convenient for the family and the infant toddler provider. So our Bridges coordinators are welcome to come out in person if that's what they want, or they can do it via Zoom. So the process is during the first meeting, when they have the introduction meeting, it's just about getting to know each other. And that even can entail maybe the Bridges Care Coordinator going on a home visit with the infant toddler provider if the parents would like that. And so that's a really cool way for them to get to know the family. After that first meeting, then they schedule times to meet with the family, and they do what is called a Bridges assessment. It's really a conversation with some kind of guiding ways to do it that identify family needs. And at that point, then the Bridges Care Coordinator and the family develop an action plan that focuses on what's the most important to the families and break down the steps into manageable pieces, much like the Part C individuals do for an IFSP. So it's really, again, I want to focus on building relationships, and that's how we do the training, is really about building those relationships and having those conversations. It's not about a check sheet. So they'll continue to follow the family per the action plan. So steps in the action plan might say, follow up with the family in 6 weeks or 2 weeks or whatever that needs to be. If the action plan does not have a specific follow-up time, then they're required to follow up every month for the first 3 months and then every other month thereafter. They will send the family at the end of the year prior to the child's next birthday. They will send a renewal application. Again, a really brief 3-page application that families can fill out and send in very quickly. Families can complete the renewal application each year to continue to be on the program. So the Bridges Care Coordinators have monthly requirements that they will complete a monthly SurveyMonkey report that gives us data that we can then share back to the All In for Kansas Kids grantees, or grantors, I should say. And they also will participate in monthly, what we call virtual touchpoint meetings with our KDHE team. What that looks like is it's basically a virtual meeting where we just really touch base with them to find out how is it going, what kinds of things have come up that maybe you need some help or some guidance with. How can we better support you in what you're doing? Just to have some basic discussions on, if they've run into a roadblock with a family or a situation that's very, very difficult and they're not sure, where to find the resources or the support. We are so used to doing this at KDHE that this is a way that we can provide additional services to them. The Infant Toddler Tiny K programs also complete a monthly survey. It takes them literally 5 minutes to complete, and it's basically finding out how many applications they've given out, how many families have completed applications and returned them, and how many partnership or introduction meetings have occurred, as well as is there something else you want to see within the Bridges program that's not here, or a change that you would recommend making. As I said, this is a pilot, so we want feedback from all the Bridges Care Coordinators and all of our Tiny K partners, because we know that they have valuable insight, and we want to make the changes necessary to make it a successful program. So the family requirement, of course, after they submit their application, they're automatically accepted. Families will complete a SurveyMonkey 2 times a year. It's just a brief SurveyMonkey to find out how Bridges is working for them and what additional things we could do to support them. And then they'll complete their renewal application once per year on or before the child's next birthday and submit to their care coordinator. So the next steps as we move forward with Bridges, because we're now in the phase where all of the care coordinators are trained, all the tools are developed, the data system's done, everything is in place, and we are now starting to take in clients. We have the ability to take 50 families that are English speaking and 10 families that are Spanish speaking. If we see that we can expand that and care coordinators have the capacity and we have the funding, we will expand that as well. But 60 was what we had budgeted for, so we felt like that would give us a really good starting grid. So the next steps are to develop the family survey that can be completed every 6 months. We haven't put that fully in place yet, so we're going to be working on that. We're going to be begin collecting data this month, as a matter of fact, from the Bridges Care Coordinators and the Tiny K partners, so that we can go ahead and start putting that data in a synthesized way and reporting that back to the grantee or grantor. Develop an online training for families and Bridges Care Coordinators based on feedback from families and providers. We know that a lot of times we have a family navigation training that we do that we've always done in person. So we'll be modifying some of the trainings for that talks about self-care and things like that will be available for families. So we're going to be working on that this year. We're going to continue with the monthly surveys for the Tiny K providers, as well as the monthly touch points for the Bridges Care Coordinators and their surveys. And we're going to continue to do quality improvement and quality assurance work to assess the program throughout the process as we're collecting data to report back. And so from this point, I'm going to turn it over to Kaylee, who is going to tell you how, and as you hear Kaylee talk, you're going to see how Bridges falls in line with everything that they're doing for the holistic care coordination expansion. Thank you all.
Thanks, Casey. Yeah, so just as Casey mentioned with Bridges, the holistic care coordination primary care expansion efforts are also aligned with the All In for Kansas Kids strategy 2.1.5. And so we're doing a this is under objective 7.4 is how they align with cross-cutting objective to expand to public and primary care. So to support this, we are looking to establish supports, guidance, and tools for public health and primary care providers that are interested in delivering holistic care coordination services to families. So to do this, we decided to align our work with the National Care Coordination Standards, which Kansas was actually a part of developing. And so we've really used this project to focus on gaining provider input on knowledge, attitudes, beliefs, and practices as it relates to care coordination and what's happening right now. So this information has informed the toolkit that we can use to provide technical assistance to primary care providers that are interested in establishing a more holistic approach to care coordination. So what's on the screen right now are those domains of the National Care Coordination Standards that we are aligned with. Okay, and then the provider input activities that I discussed, we've held roundtable sessions. We participated in Turn a Page, Touch a Mind, TAPTAM, with the Kansas chapter of the American Academy of Pediatrics. And then we also did a survey that went out to providers and anyone who participates with holistic care coordination. So we all together touched and talked with 181 providers. So these providers included physicians, program managers, directors of organizations, and outreach or engagement coordinators. Many of these were directly involved with providing care coordination for patients, clients, or families. We've been able to gain a lot of information from them to inform our toolkit that we're working on. So some of the great information that we've got from them, we'd like to share with you. We asked a question of who is responsible for care coordination services. It was really interesting because in this is an excerpt from the survey that we had. No one selected that the care coordination is the family's responsibility. So that was 0, which is great. But when we talk to families, that's not what we hear what's happening. We hear that a lot of that care coordination is falling upon the families. But what this tells us is that there is a lot of interest among providers to engage with families in that way of providing care coordination for them. So actually, when we asked TAPTAM participants if they have a care coordinator in their practice, we had 36% state that they didn't have one, but that they wanted one. And then 50% of participants said that they already had someone providing care coordination, but that wasn't their only role. So oftentimes they talked about it getting swept under into a nurse's job as they're checking in. So they talked about not being able to have as much time as they wanted to provide that care coordination. So it's really interesting to hear that they wish that they could prioritize these services. And they also mentioned that they really wanted to be, a lot of them mentioned that they wanted to be more holistic in what they do. As you can imagine, if care coordination is getting wrapped up into those other services and other roles that are trying to be done, it's not always as holistic as possible. Our next question was, where should care coordination services be provided? So when we asked these participants, many indicated that that community-based holistic care coordination is appropriate. It can work. The main thing was that it can't be done without the primary care provider. But it is really interesting to see that it doesn't matter to them as much as where the care coordination happens, but they want it to happen. So we had an option stating, I believe what matters more than where it takes place is that it takes place, and where should be up to the patient or family. So that was it doesn't matter. So that's what that section calls for. So really what this is saying is that 80% are not tied to care coordination happening in the medical community. So they believe that care coordination is also can be successful from a community setting, as long as the primary care provider is involved. And then we asked what types of services should be coordinated. So something to note here is that participants were allowed to select as many that they felt applied. And what we always found was interesting is that the specialty medical care was the lowest selected. It was not selected often. And one of the things that we kind of talked about was that other services like special healthcare needs, they're already providing that care coordination for those with specialty medical care needs. So we thought that may be a reason that it was lower. But what's not surprising is that behavioral health was top and that everything else followed really pretty closely. Educational needs, preventative well care. There was a lot of discussion about immunizations and well check follow-ups, and then social supports and community services. One of the main things that we really talked about were the barriers that we were experienced in care coordination and providing these care coordination in a holistic manner. So one of the main things that was brought up was cost, billing, and then time. So like I mentioned, there were some people throwing in care coordination into other roles, but it really didn't allow for the time. Recruiting and maintaining staff was an issue, especially in some rural places. Trainings, differing views from administration. Those were all some of the main barriers that providers experience when thinking about providing care coordination. So we have created a website to help those interested in following along with the work. We have a lot of exciting upcoming initiatives. So we'll talk about those in a minute, but if you want, the link to our website is on the slide right now. And then in the coming month, the first part of the toolkit will be released. So like I mentioned, this toolkit is aligned with the national standards. It provides tips and considerations as well as resources associated with those domains that I mentioned earlier. But this toolkit will really be used to be able to access or to help provide technical assistance to providers that are interested in implementing holistic care coordination into their practice. And those exciting upcoming activities. In the coming months, a short-term quality improvement initiative will be held to support the review and approval of the tools in the toolkit, that the providers will be able to use these tools and provide us feedback. That should conclude in the fall. And then following that will be a Project Echo that will take place. And then we will move on to learning collaboratives, which will engage with providers in direct one-on-one technical assistance in establishing a holistic care coordination program. They can work on establishing patient advisory boards, engaging policy discussions, anything really to assure the long-term sustainability of HCC or holistic care coordination services for all children in Kansas. And now I'm going to move back to Heather to wrap everything up and tie everything together, but thank you.
So just to wrap up, we also want to share about a couple of other initiatives that are taking place that we've been involved in and we're monitoring to see how they're going to impact care coordination related work under this work through All In for Kansas Kids, as well as our Title V work. We do hope to establish some shared training protocols and a curricula for those who are providing care coordination across the state. And we're working to align existing initiatives to support expansion of community health workers, of the community health worker workforce, build stronger partnerships with Medicaid and managed care as it relates to the provision of care coordination to Medicaid beneficiaries. And then we also hope to establish, as Kaylee mentioned, a technical assistance center for public health and primary care providers who are interested in expanding care coordination services. And that could be anywhere from creating a program where they could start implementing and providing care coordination, or simply looking at how they can become more holistic in their approach. Maybe looking at certain parts of the domain standards where maybe they feel like they would want to expand and create more robust programming around that. And so the technical assistance opportunities will be pretty robust and vast and really one-to-one implementation support, offering resources, financial incentives, trainings, things like that to really support the expansion of care coordination. And again, that technical assistance will also help with anywhere from logistic and functional activities like establishing a practice to potentially even just providing ongoing training or support for programs that have existing care coordinators as well. So as you can see, there are already many opportunities for collaboration and partnership in this work. We're all really excited to share the progress with all of this with you all and see where all of this can take us. So I think with that, I will just open up for some questions, and I have no idea we have lots of time. So hopefully Hannah and Debbie are good with the amount of time we've left for the day. But again, if you have any, feel free to direct any questions to any of us, or if you'd like to reach out, feel free to connect with us via email or, well, I didn't put our phone numbers up there, but we can always put those in the chat if people prefer to call as well. So, but we appreciate you taking the time to hear about our activities and initiatives today.
Well, thank you to Casey and Heather and Kaylee for all sharing this information. And you know, the thing that kept going through my mind as I'm hearing you talk, and of course for all of us who work in any way with the strategic plan, it's just every child thrives. That's the goal. And that definitely means every child in every child's family. And so this work that you're doing just seems very valuable, and it's exciting, and it's going to be fun to see how it grows and just continue to watch the hard work that all of you are putting into it, and all of the families that are benefiting from it, because this is a conversation need that we keep hearing over and over again within the early childhood system work. So thank you again. And I'm not seeing any questions. So if not, we can move ahead and just wrap up our meeting today. We always want to give you reminders about some meetings. I had mentioned the Early Childhood Recommendations Panel meeting on August 20th before when we were visiting, and please make sure and reach out if you have any comments that you would like to make at that or any of our upcoming meetings. As always, our biweekly webinar will be in 2 weeks, and that is on the 25th of August. And we also welcome you to get with us and share any topics that you are interested in hearing about, or if you have information to share with us like the KDHE team did today. We have our next a little bit of time before our cabinet and stakeholder group meeting happens again on October 1st. And we just want to thank all of the those of you listening in who might have joined our stakeholder group meeting last week, because it was very informational and good, and we always want to see as many people there as possible as well. So please share your feedback with us of any kind on at this link here on the Kansas Children's Cabinet website. And we are always love to hear from you. And as we all go our separate ways today, my quote for today is from Margaret Drabble, and it is, "When nothing is sure, everything is possible." And so I just want to say good luck to all of our students, our parents, our teachers, and our service providers that are getting ready to start a new school year, probably this week or next. We just wish all of you well. We want you to stay safe and just have the best years possible. And so thanks for joining in today. Everyone have a great rest of your day, and we will see you back here in 2 weeks.
Thank you.
Thanks.
Thank you.
Bye, everyone.
Thank you all.
Bye.